Hi, I'm Armand Diaz, and I'm here today with Dr. Gail Lowenstein. Dr. Lowenstein graduated from Washington University School of Medicine in 1979, completed residency training in internal medicine from Long Island Jewish Hospital, and fellowship training in geriatric medicine from Jewish Institute of Geriatric Care, now Parker Jewish Geriatric Center. She's board certified in internal medicine, geriatrics, hospice and palliative medicine, holistic medicine, and has added qualifications in functional medicine. Additionally, she is a certified wound specialist from the American Academy of Wound Management and is a certified medical director from the American Medical Directors Association. Dr. Lowenstein has had a 24-year career as chief medical officer of a nursing home dedicated to the well-being of Holocaust survivors. She founded the holistic program at that facility, partially through grant support, designed to address body, mind, and spirit of residents and staff within the facility. In addition to providing oversight to the long-term care and short-term rehabilitation patients, she also provided oversight to the center's inpatient hospital unit and adult day healthcare center. Currently, Dr. Lowenstein has a telephone consultation service providing expertise in geriatrics, palliative care, wound management, and holistic medicine. That is quite a resume. Tell me, how did a Western-trained allopathic physician get involved with holistic medicine?
Like so many Western-trained physicians, when we get sick and Western medicine doesn't help us, that's when we learn all about alternative medicine. And for me, my knees began to hurt me for no known reason. I went to an orthopedist, internal medicine, I went to a rheumatologist, and no one could figure out why I was having knee pain. And I ended up seeing an acupuncturist who helped me so much that I ended up writing 3 grants to bring him into the nursing home where I was the chief medical officer. He began to teach me holistic medicine, and it was a wonderful education.
Wow, so it came from your own experience.
Oh, yes.
And what is functional medicine?
Functional medicine is, for me, the bridge between alternative medicine and Western medicine. It looks at the root cause for all chronic illness. When you find the root cause, you're able to reverse and even cure many of the chronic illnesses. Whereas Western medicine looks to ameliorate the symptoms, functional medicine looks at why do you have those symptoms. Inflammation is the etiology for virtually all chronic illness, but the reasons for the inflammation are varied. It can be food allergy, it can be parasites, it can be heavy metals. There are many different reasons, and the art and science of a functional medicine practitioner is to find what is causing your inflammation. So even though the symptoms may be identical in 2 different people, the etiology for those symptoms may be totally different.
And this is very different from Western medicine, which would treat the symptoms.
Yes. So in Western medicine, 2 people with osteoporosis would be treated the same, generally with a medication such as Fosamax to strengthen the bones. But in functional medicine, we'd be looking at why are you having osteoporosis. And so osteoporosis for some of us is related to the foods we're eating. That the concept here is that we're eating foods which are causing too much acid in our bodies. And so the body is pulling the alkaline ash from our bones in order to decrease the acidity.
Wow.
Yes, it's very fascinating. When I do my classes on holistic healing, I have a whole section about alkalinity and acidity in the body. Now I hold the classes at the Sid Jacobson Jewish Community Center. The first set of classes, I had over 50 people attending. This is all pretty much word of mouth through the emails to people. I have quite a following now. People come every year. I keep on changing the material.
And the telephone consultation service that you have, how did you get started with that?
Well, like so many healthcare professionals, when our friends and family get sick. They call us really when this 85-year-old woman, who I barely knew, called me on a Sunday morning about a 105-year-old mother. I really got it, that it must have taken a huge amount of gumption on her part. She must have been so going out of her mind that she would basically call a virtual stranger to help her. And in fact, in 10 minutes, I was able to help her. And so I realized that there is no one out there doing services like this that I'm aware of, that the public really needs a professional who knows the system, who could support them and give them alternatives to what Western medicine is proposing.
But in addition to the phone consultation service where you handle the problems as they come up, you also teach these classes which will prepare people for them, and that's got to be very, very important.
Yeah, the classes are something new that I'm starting because many of the people that I've helped over the phone have not followed my advice. They've appreciated having the advice, but they did not follow it, and then they were sorry that they did not. And so if I could teach these seminars to people before they are in crisis, then perhaps they'll be more likely to follow the advice once they are in crisis.
Right, so that having that knowledge beforehand is very, very important. I know from experience that's very, very important to be ready to go, because there is a tremendous pressure from the medical establishment typically to go in the way that they are suggesting, and people have a lot of trouble with that.
Yes.